Welcome to my channel, Brainies. In today's topic, I am going to talk about the 180-degree turn test. This 180-degree turn outcome measure, it is also known as 180-degree turn test, also known as timed 180-degree turn test. It's basically used to assess the dynamic balance and the postural stability in individuals, particularly in neurological conditions like stroke or Parkinson's disease. It helps to identify the individuals, those who are at risk of falling, and provides an indication of the severity of the balance. The indications of 180-degree turn test are the dynamic balance, postural stability, that is the body's ability to maintain an upright and balanced position, especially when they are performing the complex movements like turning. The main uses of this 180-degree turn test are the fall risk identification. The test can indicate the severity of the balance problems, and for clinical and research tool, it's a valid and reliable test which can be used in clinical settings and even in research to assess the patient's turning abilities. The method of performance of the particular test. So to perform this 180-degree turn test, ask the patient to stand with feet completely apart. Ask them to turn slowly in a full 180-degree circle and count the number of steps which has been taken to complete one turn. A common benchmark is that taking 5 or more steps may indicate a high risk of falling. For a formal assessment, we can use a stopwatch to time the turn. Ask them to perform the test multiple times and you can take the average out of it, and have reliable handholds nearby for support of the patient. The steps of the method: find a safe space, position the patient, ask them to turn 180 degrees, count the number of steps, maintain the balance, use the handholds, time the turn, that is the duration taken. Ask them to perform multiple trials, note the results, interpret the results, measure the number of steps taken. So this test helps to assess the balance and functional mobility, and these scores are often used by healthcare professionals to identify the individuals who may benefit from fall prevention strategies. So the significance of the 180-degree turn test: it assesses the fall risk, detects the functional impairments, distinguish the population, that is, it's able to identify the healthy older adults and those with mobility impairments. And it is used in broader assessment, like it's a component of a larger and more complex mobility test, including the TUG test, that is the timed up and go test. By isolating this particular turning component, clinicians can even gain more specific insight into the balance issues. That's it with my today's video. Thank you for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.